Good afternoon, everyone. Welcome to the SGH Osteoporosis and Bone Metabolism Unit Public Forum. My name is Dr. Ann Kui, and I'm one of the associate consultants at the unit. Thank you for taking time to journey with us today to learn more about osteoporosis. Our unit has been holding these forums since 2007. We really enjoy doing these public forums to help raise awareness around osteoporosis. Osteoporosis is a very important topic because firstly, it is a silent disease, and secondly, the number of fractures are increasing worldwide. In most parts of the world, this is becoming a huge problem because of our aging populations and increasingly sedentary lifestyles. We have many wonderful speakers lined up today. They have taken precious time out of their schedules to share their expertise with us. We appreciate this very much. I would also like to make a special mention at this time to our unit's two specialty nurses, Xiao Ming and Xiao Feng, for their contribution to making this day happen and for being an integral part of our unit. We have more than 1,000 participants over Zoom, not to mention those on Facebook Live. Please post any questions that you may have into the Q&A box so that we can try to address them at the end. However, due to the overwhelming number of participants, we will have to prioritize questions pertinent to our topic today. I do apologize in advance if we are unable to answer all your questions. I hope that you will enjoy all the talks and demos that we have lined up today. Don't feel shy to get up from your chair and join Dr. Cindy Ng when she demonstrates some simple exercises and dance your way to healthy bones with foot tapping music during our dance session. Please do, however, only do this if you are in an environment that is safe to do so and if you're physically up to it. It's time for a celebration as well because we are celebrating the World Osteoporosis Day on October 20th. Remember, our goal this year is to stop osteoporosis in its tracks. Let's get started with our first speaker today, our very own Director of the Osteoporosis and Bone Metabolism Unit, Prof. Manju Chandran. Prof. Manju Chandran is a senior consultant at Singapore General Hospital, Department of Endocrinology. She is a faculty member at Duke NUS Medical School. She wears multiple hats: chairperson of the Asia Pacific Consortium on Osteoporosis, board member and council of scientific advisors of the International Osteoporosis Foundation, faculty of the Skeletal Rare Disorders Academy of the IOF, task force member of multiple disease consensus boards, vice chairperson of the Asia Pacific Panel of International Society of Clinical Densitometry, but a few of her appointments. She is also the recipient of the 2021 International Osteoporosis Foundation Olaf Jonell Science Award for her global contributions to the field of osteoporosis. This international recognition, amongst multiple other awards she has received, have helped to put Singapore metabolic bone field on the global map. And we are so proud of that. Welcome, Dr. Manju.
Thank you so much, Dr. Ann, for that very kind introduction. So again, good afternoon, everybody, and welcome all of you to our 14th SGH Public Forum on Osteoporosis. As Ann said, we've been doing it since 2007, and believe it or not, whether it's the first time or whether it's the 14th time, it's still as nerve-wracking as it is when we organized it for the first time way back in 2007. So I think what I'll do today is just dive right into the presentation for today, which I'm just going to give you a very brief introduction to osteoporosis. Obviously, in a 20-minute talk, I'm not going to be able to cover the entire field of osteoporosis. So just to kind of give you an introduction, and then we have this wonderful speakers lined up to continue with the rest of the session. So may I have the first slides, please? Okay, so good. So I understand that there are about 1,250 participants on Zoom tuning in, and again, probably there is an equal number on Facebook. So I'm sure a lot of you have lots of questions, and which we may not be able to kind of cover the entire topic in just 20 minutes, but we'll try. Okay, so let's dive right in. So those of you who thought that bone is a dead tissue, you got it completely wrong. Bones are living tissues and constantly in a state of turnover, making mineral deposits and withdrawals daily. So from the time we are born till the day we drop dead, literally, our bones are working super fast, and over time, in fact, they're working full time 24/7 to form bone, and actually old bone is also removed. So I'm a very simple-minded person, so I like to think of this, what we call pathophysiology of bone loss, in very simple terms. So normally, from the day, like I said, we are born till the day we are dropped dead, bone is a living tissue. There is this constant state of turnover which is happening, and I like to think of these little cells inside the body called osteoclasts and osteoblasts. Now you might wonder what osteoclasts are, and you might wonder what osteoblasts are. Osteoclasts, I like to think of them as these bone destruction cells. What they do is they remove old bone, and then these osteoblasts, or the construction workers, come running in, and what they do is that they build a new bone. So this process, this is called bone turnover or remodeling. This happens throughout our lives constantly, 24/7. So when you reach peak bone mass, so I said from the time that we are born, this is happening. So peak bone mass is reached around the age of about 25 to 30. So 90% of adult bone mass is in place by the end of adolescence. So as you can see on the slide, so peak bone mass, pretty much it's the same in men and women. It's approximately around the age of about 25 to 30, somewhere in between. So majority of those bone mass is put in place during childhood and adolescence. So bone mass in later life depends on peak bone mass achieved during growth and then the subsequent age-related bone loss. And as you can see at the top of the slide, after the age of about 30, 40, all of us start losing bone. Now unfortunately in women, because we go through this abrupt menopause at around the age of 50 or so, we suffer very acutely bone loss, and you can actually, I'll show it in the next slide, and how much that bone loss can be quite significant. But then there's age-related bone loss in both men and women. So what happens? So this is changes in BMD with age. Like I said, bone density peaks around 20 to 30 years of age. Men about the age of about 50 or so, they start losing bone at the rate of about 0.2 to 0.5% per year. But after menopause in women, because you're losing this bone abruptly because of menopause and because the female hormone, the protective hormone called estrogen, no longer is around, you get a decrease about 3 to 5% per year for the first 5 to 8 years after menopause. Now after that, the bone loss kind of slows. It decreases about 1 to 2% per year thereafter, but you can still see that we do continue to lose bone. So what is osteoporosis? So today's session is all about osteoporosis. So what is osteoporosis? Osteoporosis, very simply put, comes from the Greek word osteon, which means bone, and porosis obviously means porous bone. So osteoporosis is porous bone, and is weak and brittle bones caused by bone loss. So what happens when you have osteoporosis? Because the bones are going to be so fragile, this will predispose a bone to fracture. Now, osteoporosis occurs when the process that removes, remember I told you there is this constant process of bone turnover happening, which is a process of bone removal and a process of bone formation. Osteoporosis occurs when the process that removes old bone and replaces it with new bone becomes imbalanced. So bone removal more than bone formation equates to bone loss. Now I have to stop here and apologize for a second. I had memorized the Chinese words for marriage made in heaven, but now it completely slips my mind. So essentially, normally what happens inside the body is this beautiful marriage between the osteoclast and the osteoblast. It's a marriage made in heaven, but osteoporosis happens when that marriage pretty much dissolves, and so there is complete takeover of bone loss, which exceeds bone formation. So it becomes an unequal partnership. Again, I forget what the Chinese phrase for that marriage made in heaven was, but this is one of my paintings which I did like when I used to have time for all these kind of things before, signifying the phoenix and the dragon who are working in close unison together in normal life. This becomes disrupted when osteoporosis happens, when bone loss exceeds bone formation. So again, for a simple-minded person like me, I like to think of it as this way, in which in the top left-hand side, you see this normal bone turnover when the osteoclast, which is a bone destruction worker, and the osteoblast, which is a bone formation worker, working together in harmony. Life is perfect, but then you can see in osteoporosis, it becomes completely disharmonious. They're completely at odds with each other, and it's mayhem. And in fact, bone loss exceeds bone formation, and that's when osteoporosis happens. So what happens when you have osteoporosis? The problem with osteoporosis is that it's a silent disease. You may not even know that you have osteoporosis till you have a fracture. Next slide, please. Okay, so we come to the topic of what is a fragility fracture. Now, a fracture that happens with very minimal trauma or even spontaneously is called a fragility fracture, and this is a typical osteoporotic fracture. Like I said, you may not even know that you have osteoporosis till you have a fracture. Some of my patients come to me and they're being screened. I mean, I'm seeing them in my clinic, and I get the history from them, and they'll say, no, we have never had a fracture. And then I probably might send them for an x-ray, and I might see that there is a backbone fracture. So they may not even have known that they had the fracture, and that's when when I tell them that, hey, there is a vertebral fracture in here, and that's when they even find out that they have osteoporosis. But sometimes fractures happen with very minimal trauma. For example, you might be just lifting up your little grandchild, your little baby, and that might actually result in a backbone fracture. So I've got like my Miss Skeleton and Mr. Skeleton over here just to kind of show you where some of the common sites of fragility fractures are, or osteoporotic fractures are. So this is the spine, obviously, you can see this, and so the spine is a very common site of fragility fractures. The other common site is the hip. This is the hip bone, as you can see. So again, how I try to kind of explain to people this is that when you're a younger postmenopausal woman, say for instance, she will still have a protective mechanisms intact, right? So let's say she's walking along the street, minding her own business, and then she slips and falls, and she'll put her hand out, and if this is the lady has osteoporosis but is younger and her protective mechanisms are still intact, she'll be able to put her hands forward and break her fall, and that results in a wrist or a distal, what we call a distal radius fracture, the fracture of the wrist. Now, an older person, on the other hand, and if you can zoom the camera in a little bit closer, I can show you. So an older person, an older lady whose protective mechanisms are completely lost, what is going to happen is that she, instead of falling on her hand, what's going to happen is that she's going to fall on her side, and that results in a hip fracture, or she can fall on her behind, and that can result in a backbone or a spine fracture. And just to kind of show you, this is kind of heavy, so I hope I'll be able to lift it. So this is the backbone, the vertebrae, and this is an extremely common site of a fracture. And the other places which is a very common site of a fracture is the hip. So this is just to kind of show you where some of the common sites of osteoporotic or fragility fractures are. Back to slides. So how can you tell that you have osteoporosis? So I said, if you have a fracture, then that's osteoporosis unless otherwise proved. Now, you might be able to tell that you've had a fracture from a little kind of tip that I'm going to tell you. Now, all of us lose height as we grow older, right? We lose about 3 to 4 centimeters in height compared to a peak adult height. Now, if you have lost more than 4 to 5 centimeters of height compared to your peak adult height, that could, I'm not saying that's 100%, it could suggest an underlying vertebral or spine fracture, because what happens is that when you have a spine fracture, you start hunching and you lose height. So if you have lost about 4 to 5 centimeters of height compared to your peak adult height, that could suggest that you have a silent vertebral fracture. So how can you predict a fracture in your future? So when you look into that crystal ball, how can you tell whether you are going to be one of those unlucky people who are going to have a fracture? Again, we cannot predict it 100%, but there are some risk factors for both osteoporosis and or fractures. Now, what I'm showing you on the left side of the screen are what I call the non-modifiable factors, and what I'm showing you on the right side of the screen are the modifiable factors. So obviously all of us grow old. It's an inevitable part of life. We all grow old, and so as you grow older, your risk of having osteoporosis increases. Being female puts you at increased risk for osteoporosis just because of the fact, remember what I told you earlier, when you attain menopause, you lose your protective hormone estrogen suddenly, and this can result in bone loss and in osteoporotic fractures. Being very small and thinly built can put you at risk for having osteoporosis. I didn't put this one. Just being Chinese and Caucasian also actually kind of puts you at an increased risk for osteoporosis, and this is kind of racial differences in your risk for osteoporosis and osteoporotic fractures do exist. Early menopause. So the average age of menopause is around the age of 50 or so. In some populations, for example, the Indians living in India, they have an earlier menopause at the age of about 46 or so. So an early menopause would be something which is considered below the age of 45. That can actually put you at risk for having osteoporosis because, again, you're losing the protective hormone estrogen much earlier. If you have a family history of osteoporosis, obviously this is not something that you can change. You can't change your parents. So if you have a family history of osteoporosis and fractures, that does put you at increased risk for having osteoporosis. A previous history of fracture can put you at risk for having another fracture. And this is what we always emphasize in our clinics. One fracture begets another fracture. So that can put you at risk for having another fracture. Now, on the right side of the screen, what you're seeing are some of the modifiable factors, which of course you can change, right? Smoking is very bad for your bones. Drinking more than 3 units of alcohol per day is considered bad for your bones. Now, you might ask me, I'm not a very heavy drinker, but you might ask me, what is a unit of alcohol? Probably a unit of alcohol is about 10 ml or so. So a small glass of wine is about 1.5 units. So more than 3 units of alcohol per day may be associated with an increased risk of fracture. Excessive coffee intake. Now, why? Caffeine can actually leach calcium from your bones and into the urine. So coffee intake is bad. Excess coffee intake is bad for your bones. And so not more than maybe like 1 or 2 cups of your favorite java per day. Okay, not more than that. Very little exercise. If you're one of those couch potatoes, that's going to put you at increased risk for having osteoporosis. Lack of vitamin D and calcium, we'll talk about that briefly. And then there is this other condition which I want to just spend a couple of minutes on, which is secondary osteoporosis. So how can you, I said, so these are some of the risk factors which I've shown you. Now, another way by which you can kind of estimate whether you're at risk for osteoporosis, there are these simple tools that are available. Now, one of them is the International Osteoporosis Foundation Risk Check. You can easily Google online, and I've put the link, the website address underneath. So you just Google for International Osteoporosis Foundation, and they have a simple risk check tool. It's just 1 minute. You can just tick, 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 and it'll kind of take you to an estimate of what your risk for osteoporosis is. There are other tools available called OSTA, which is Osteoporosis Self-Assessment Tool for Asians, but obviously I don't have time to spend elaborating on all of these. But this is one simple tool that you can use. Now, remember I talked about secondary osteoporosis. Secondary osteoporosis, so what I've been talking about till now is what we call primary osteoporosis. Now, secondary osteoporosis is osteoporosis which happens because you have some other underlying condition which causes bone loss. Okay, so again, there are several hundred contributors. I'd like to call them contributors rather than causes of osteoporosis. So these are contributors. So say, for instance, you have rheumatoid arthritis, or you have an overactive thyroid gland, which is called hyperthyroidism, or if you have an overactive parathyroid gland, that can contribute to osteoporosis. Diabetes, believe it or not, both type 1 and type 2 diabetes are associated with increased skeletal fragility. Losing too much calcium in your urine is another contributor to secondary osteoporosis. Now, on the right side of the screen, I'm kind of showing you some of the medications which may be associated with bone loss and fractures, of which steroid medications. Now, these are glucocorticoids. I'm sure some of you may have heard of them. So steroid medicines are usually given for conditions such as asthma and rheumatoid arthritis, etc. Steroid medications, obviously, if you have those conditions, you have to take them. But your doctor should be able to kind of assess how much you should be taking, and so long as the doctor is aware and you are aware that these medicines may be associated with bone loss, you will be weighing the risk versus the benefits and taking them accordingly. Please do not stop any of your medications after hearing this forum just because you see them listed here. Like I said, you and your doctor should be aware of this, that's all. Excess thyroid hormone, excess thyroid hormone, which is given for certain, thyroid hormone is given for certain conditions, including like thyroid cancer, and when that's in excess, that may also be associated with bone loss. But just to kind of show you, now, the problem is that most of these conditions which I showed you on the left-hand side, they can be picked up only by laboratory testing. So if you're coming in to see me or any one of the doctors who's taking care of your osteoporosis, the doctor might say that, hey, I need to do lab tests. And you might be like, why should I have lab tests? Now, we're not doing it just because we love taking blood. The reason is that the conditions which I showed you on the left, a lot of them can be picked up only by blood testing. And this is one of the studies that we did actually in Singapore, which showed that even what we think of as something garden variety post-menopausal osteoporosis, 44% of our population had one or other contributor to secondary osteoporosis, which was picked up only by lab testing. And when it comes to men, about 60% of men had one or other secondary contributor to osteoporosis, which was picked up only by lab testing. So this is why the doctor is asking you to get some blood and urine tests done when you're seeing them in consultation for osteoporosis. So now we kind of digress a little bit, and all of us know that men are from Mars and women are from Venus. So if you thought that osteoporosis happens only in women, think again, it can happen in men too. But men start off, men have an advantage when it comes to osteoporosis, because compared to women, osteoporosis related fractures are lower and occurs later in men. And why is this so? Now, if this was one of those pre-pandemic public forums in which I had direct access to a large audience face to face, I would have obviously asked the question out to the audience. But of course, because of this pandemic and all these restrictions that we have, this virtual scenario in which I have no idea who I'm talking to. I think sometimes I feel that I'm talking to an empty void, but I guess I'll answer my question myself. Men begin with a higher peak bone mass than women, right? So they start off with an advantage. They start off with a bigger bone bank than women do. So that itself, their peak bone density is higher. And why is this so? Because testosterone, the male hormone, increases bone formation and muscle mass, and it causes higher bone density and also may prevent falls. And the second important thing is that at the other end of the spectrum, men do not undergo the rapid bone loss that happens to women after they attain menopause. So because of these two reasons, men are at an advantage when it comes to osteoporosis at least. But if you thought only women got osteoporosis, think again. Approximately 30% of all osteoporotic hip fractures and 20% of all osteoporotic vertebral fractures occur in men. So the men in the audience, please do take note. Of course, you are at an advantage, but doesn't mean that you're spared. And I don't want to be an alarmist, just kind of keep this in your mind, that's all. So but 1 in 5 to 1 in 8 men over the age of 50 will have an osteoporosis related fracture in their lifetime, whereas it's 1 in 3 women who will get an osteoporosis related fracture in their lifetime. So that is very important to take note. So we've kind of moved through, like I just told you, how we build up peak bone density, and I said we talked about age-related bone loss. I talked about how women are at a slightly more disadvantage when compared to women, and I told to men, I'm sorry, and I told you about secondary osteoporosis. I told you about the risk factors for osteoporosis and osteoporosis-related fractures. So now what can you do? I've come here and stood for the last 10 minutes talking about all this. So is there something that you can do? There are several strategies to prevent osteoporosis. Again, but let me step back here for a second and emphasize that it's 80% of your risk for osteoporosis is genetically determined. Okay, so it's only 20% that can be modified. So don't think that, I get patients all the time asking me, but I've been taking calcium all my life, I've been exercising, but why did I still get osteoporosis? Unfortunately, that's the case. Like I said, 80% of the time, you really can't do anything, but there's a big chunk of 20% which you can still do do something, right? So there are several strategies to prevent osteoporosis. Like I said, a good healthy lifestyle, adequate exercise, a good healthy diet, not smoking, not drinking too much of alcohol, or avoid too much caffeine and salt intake, etc. So these are some strategies that you can use to prevent osteoporosis. So the most important thing, obviously, let's start off with feeding your bones right. Again, this is my attempt at some artwork, but so you have to feed your bones right. And how do you feed your bones right? This is with both calcium, vitamin D, and there are a host of other nutrients which are involved. Now again, I would like to step back again for a second, because people tend to assume that calcium is the answer for osteoporosis. It's not. Calcium, definitely a good healthy intake of calcium is definitely necessary to build up your peak bone mass in your childhood and adolescence, and it may modulate the rate of bone loss which happens in later ages, in your older ages. But whether calcium on its own or even with vitamin D can completely modulate the rate of bone loss which happens with aging, prevent osteoporosis and prevents fractures, it's unclear. So, but good calcium intake is definitely important. And what is considered as a good healthy calcium intake? For adults above the age of about 51, it's 1000 milligrams of calcium from the diet is obviously better. People ask me about supplements. When I'm giving public forums, I get eaten alive with questions about supplements. Supplements are okay in those people who really can't. Say for instance, you are one of those people who cannot handle milk. Lactose intolerance is very common in Asians. Or if you have, if you hate milk, or if you can't take any of the other products which contain calcium, there are non-dairy products which are rich in calcium, or in elderly people whose diet is kind of poor, then we definitely do recommend calcium supplements, but intake from the diet is really the best. So this is about 800,000 milligrams of calcium intake is essential. And there are some non-dairy products. I'm just briefly showing this on the screen. There are some non-dairy products which contain calcium, and I'll just leave the slide here for a second so that you can kind of just make note of it. I'm not a dietitian, but I know enough just to kind of get me by when I'm seeing my patients. And of course, we have a dietitian on board who can always help with my patients in clinic. So remember, calcium alone does not protect your bones. Vitamin D is needed for calcium absorption. And now where do you get the vitamin D is the question. Again, there are two sources of vitamin D from the diet. Now, those of you maybe of my vintage who have been subjected to this prodigious intake of cod liver oil when you were a child, you would probably remember the awful taste. That's what I remember about cod liver oil. But cod liver oil, of course, is very rich in vitamin D. Oily fish like salmon, for instance, and it depends on whether it's wild salmon or farm-raised salmon, but salmon, these are oily fish, right? Tuna and all these are oily fish. They contain they are good sources of vitamin D. Mushrooms are a very good source of vitamin D. But again, I'd like to emphasize that these food sources, it's very difficult to get vitamin D because you really have to take a lot of these sources to get the right amount of vitamin D. Sunshine is the best, and again, because we can't get directly vitamin D from sun, but our skin is capable of making vitamin D. But the important thing to remember is that this happens during the hours of 10 and 3, and it's because there's absorption of this particular UVB rays between this 290 to 315 nm is what can help make vitamin D in the skin. And again, it depends on your skin tone, because a darker skinned person like myself, for instance, will require to be a little bit longer in the sun than a much fairer skinned person. So between the hours of 10 a.m. to 3 p.m. and a good thing to remember is that when the shadow is shorter than you. But the problem is that we are so scared of the sun now. We evolved in the sun, so why are we so scared of it now? So other important nutrients, like I said, these are important: protein, vitamin K, zinc, magnesium, etc. But I really don't think that you need to take these extra supplements. Maintain a well-balanced diet. Exercise is very important. Bone building exercises are the weight-bearing exercises, and I'm not even going to talk much about it because we have got this amazing speaker coming on later, Dr. Cindy Young, who will be talking to you about that. But again, we have become a very sedentary society, and moms of teenagers, I am a mom of a teenager, and we know how difficult it is to get these young people out now and exercising and in the sun. So this is something which we have to kind of think about. Very last couple of slides, treatment. Like I said, even after you do your best and all that, some people of course will still get osteoporosis. What do you do for treatment? The problem is that even though there's a plethora of medications available to treat osteoporosis, the sad fact is that osteoporosis still remains underdiagnosed and undertreated in almost all parts of the world. What does treatment do? Treatment, the medications, we have a plethora of medications, like I said, they act either by reducing bone loss or enhancing bone formation. But again, this is a public forum. We really won't be able to go individually into each medication. So please have a discussion with your doctor about which medicine is right for you. And they will tell you how long to take the medicine, which medicine, etc., etc. So osteoporosis, unfortunately, is a silent disease, folks. So let's make some noise for it. And to know more about our own Singapore General Hospital Wishbone Osteoporosis Support Group, Wishbone stands for Women and Men in Support of Healthy Bones. You can see on the slide, I have put up the phone number which you can call. I guess this works for Singaporeans, of course. I know we have a large international audience tuning in, but right now the services are a little bit slow because of obviously the pandemic. But you can go to the Singapore General Hospital website and look up osteoporosis services, and you should be able to find more information about our osteoporosis support group, Wishbone. So with that, for now at least, that's all I have for you right now, folks. Thank you very much for listening. Now it's my great pleasure to hand you over to the next speaker. Now I have to say something about the next speaker. Is Cindy Ng, Dr. Cindy Ng, who is a senior principal physiotherapist at Singapore General Hospital. Now, Cindy obtained her PhD in physiotherapy from Curtin University in 2014. She's an assistant professor with the Singapore Institute of Technology and is a teaching faculty for the SGH Postgraduate Allied Health Institute. She has a keen interest in exercise and its impact on the management of chronic diseases, including osteoporosis. On a personal note, and I must say this, Cindy has been one of the most ardent supporters of the Osteoporosis and Bone Metabolism Unit at SGH ever since I first set it up in 2007. And I still remember the multiple brainstorming sessions we had way back then planning the osteophysio sessions. And she's been a constant, inspiring fixture at all of our previous 13 forums on osteoporosis. Thank you, Cindy, so much, and over to you.
All right. Good afternoon, everyone. Thank you very much for that kind introduction. Okay, I'm Cindy. I'm one of the physiotherapists here in SGH. So we're going to start with exercise. Now, before we do anything, make sure, if you're going to follow me, that you have a safe environment, sturdy chair, okay, right? And good pair of shoes or barefoot. Please don't wear flip-flops and slippers, all right? No, nothing wet or unsafe around your place. Now, exercise, it's an intentional activity where you move. And the main purpose of exercise is to improve your health. So that's a little bit different from doing housework, okay? All right, or window shopping, okay? And when we talk about exercise, there are 4 main domains. I'm going to start off with the first one, which is aerobic. And one of the best ways to do aerobic is walking. Now, we can do our normal walks outdoors, along the corridors, downstairs in our home, okay? But in this COVID-19 climate, we do understand some of you have some concerns and may not feel safe going outdoors. So one way of doing some form of aerobic exercise at home, what you can do now is basically have something sturdy in case if your balance is not very stable, is to march on the spot. Okay? All right. Now, if you think that you're not steady, you can always go near a wall or a chair and march on the spot. Now, if you feel that you can lift your knees higher, do high knee march. Okay? All right. Have some music. okay, to have the rhythm and the tempo. And you will realize that you breathe harder and your heart will beat faster. Move your arms if you feel that you have that balance and you are steady on your feet. Okay? How many minutes can I do this in my house? I don't really need a lot of space to do this. All right? If you can tolerate only 5 minutes, that's fine. Every 2-3 hours or 5 minutes of marching on the spot, and you will clock in 20 minutes in a day. And why 20? Because the World Health Organization states that we need to clock in at least 150 minutes in a day of aerobic activity. And that means approximately about 20 minutes every single day. Okay? All right, so that's a lovely way of getting some aerobic workout in your house. Okay? Or you can go walking outdoors, okay? Swimming, cycling, all right? Some of these Zumba dances, aerobic classes, they are the same. Okay? All right? Now, that's my first one. What's number 2? Now, number 2 is strengthening. Now, strengthening exercises are very important because we all need to recognize as we grow old, our muscles actually, lose. We do lose muscles along with age, all right? And we feel weaker. So strengthening exercise is one of the most important components, all right, in the 4 domains of exercise. Okay, so I'm going to demonstrate 2 simple strengthening exercises and 1 lower body. We're going to start off with the upper body first. Okay, now if you have a sturdy chair and you're seated, make sure it's not a roller chair, okay, because I don't want it to roll away. You can always hold onto a nice little light water bottles and do what we call shoulder presses. Okay, up and straight, next to your ears. All right, okay, you can do it with me. 4, 5, 6, you can do it in standing too. 7, 8. Now, if 8 is too easy for you, you can do up to 15 repetitions. Rest for 1 minute and repeat again, between 8 to 15 reps. Now, I like to get my clients or my patients to do it at the wall. Why? Because it will give you feedback to keep your back straight. Now, as you lean against the wall, it gives you feedback that your back is straight as you lift the hands up. Nice and straight. Okay? All right, if you hold a light water bottle, 500 ml, nice to hold. Don't carry a 1 liter because it's really hard to grip it. Okay? You can do about 8. All right, and after 8, one last one. Rest for 1 minute. And repeat. Okay? Nice and easy. Now, if you have any shoulder issues and you can't really lift up, you can do what I like to do is forward. Bring it back. You can see that I'm trying to keep your upper back straight. Okay, forward. Nice and easy. 8 to 15 reps. Okay, last 2. And then you rest for 1 minute. Okay, nice upper body workout. Okay, let's go to the lower body. Now, the lower body, I like to do what we call sit to stand. Okay, make sure, again, sturdy chair, no wheels below, because I don't want the chair to roll away while we're doing this. Feet planted nicely on the ground. Okay, you may have to sit out a little bit from the chair itself. Hands, you can either cross over your chest, put it on your waist, have it in front of you like this, or lift it and put it out front of you. I like it on my waist. All right, so let's stand up and down 8 times. Are we ready? Let's go. 1, and down. 2, and down. Slow and control. 3, and down. 4, stand up tall and straight. Good. 5, almost there now. 3 more. 6, last 2, 7, and 8. And if you're not tired, you can continue on till 15. Rest for 1 minute and repeat again for 8 to 15 times. Okay, this one works really nice on your thigh muscles, the muscles behind your knee, abdominal muscles, your back muscles. You engage all these muscles when you're doing this. Okay, so strengthening, number 2. All right, let's go to the third one, which is flexibility. Now, why is it very important to do stretching? All right, it's to actually prevent any stiffness in our joints. Okay, so we're going to do a few very simple stretching exercises, flexibility. Okay, we start from head to the toe. Okay, so let's start from the head first. So right ear to your right shoulders, tilt downwards, and bring your right hand and just sort of pull it, and you can feel a nice pull on your neck muscles. Keep your body upright, don't tilt towards the right, okay? Keep it upright. Hold it there for minimum 10 seconds, up to maybe about 15 seconds. All right, and then once you're done, keep it upright. Same thing, the other side. Put your hand on the head to pull it even further, and you can feel a nice pulling sensation. All right, okay, nice pull. Hold there for about 10 seconds at least, up to 15 seconds. Once you're done, we're going to do the shoulders. You can roll your shoulders just to relax it a bit. You know, a lot of us do a lot of work from home, and we're always forward looking. Okay, so sometimes roll your shoulders to relax those tense muscles around there. Bring your arms across your chest. Okay, pull it forward towards you, and you should feel a nice stretch on your shoulders as well. Hold there for a minimum of 10 seconds. Okay, all right, and then once you feel the pull, minimum 10, up to 15, do similar to the other side. So again, bring across your chest. Okay, if it helps you, you can hold on to the other shoulder. Okay, and then pull the elbow towards you, and you can feel a nice stretch or pull. Okay, all right, nice and easy. Very good. Okay, all right, let's start with the legs. For the legs, simple, nice stretch that you see a lot of us doing. It's quadricep stretch, where we bring our legs out to stretch the front of our thighs. Okay, hold on to something. Okay, if you find that your balance is not that fantastic, and feel a nice pull again, minimum 10 seconds. All right, no jerking actions, just. Okay, and likewise on the other side. Okay, now you can also stretch your hamstrings as well, and that can be done in sitting. Okay, as you sit on the chair, bring one leg forward and straight, and lean forward nicely and easy, and you can feel a nice pull behind your knees. Okay, all right, and hold it there for about 10 seconds. Where you are, you can follow me. Okay, all right, nice and easy. Okay, all right, once you feel the pull, you can just stop there. All right, okay, because some of us are not very used to that pulling sensation. Okay, all right, so just get it there, nice and easy, feel the pull, gentle, and that's it. Okay, and last but not least, your calf muscles. Okay, I always like to do this, where you make sure your toes are pointing in one direction. Okay, you don't need to open that wide. If you can't, just a small one, you can hold on to something. Okay, bend forward, and you should feel a nice pull in your calf muscles. Okay, all right, keep your body upright. Okay, if you find balancing is an issue, you can always hold on to your waist, have your hands on your waist, or hold on to a chair. Okay, and then once you're done for about 10 seconds, you can change. Okay, make sure your feet is planted on the ground, feet flat, pointing in the same direction, body upright, and feel the pull at your calf muscles. Okay, all right, simple stretches, and that's my third one. My last one is equally important, although it's the last, but it's equally important. That's balance or coordination. So some of you who are already doing Tai Chi, well done, keep it up. All right, it has that balance coordination component that's embedded into the Tai Chi itself. So keep it up. Some of you do Chinese dance, line dancing. Okay, all right. Now, but what sort of balance exercise can we do at home? Simple one that we can do is what we call heel-toe rock. Okay, hold on to something if you feel that you're not that sturdy, and you can tiptoe, heel. Tiptoe, heel. Make sure your body is upright. Okay, all right, keep it upright. If you can't lift your toes or your heels that high, that's fine. Small movements, like what I'm doing now. Small ones. Small ones. Okay, small ones. All right, 8 to 15 times will do. Get your ankles flexible. Okay? Nice, simple, functional coordination or balance work will be sideway walk. Okay, you can take 5 steps to the side, 5 steps to the other side, or some of us like to do just side tap. Okay? All right, side tap. Okay, another challenging one will be what we call, if you hear the physio talking, tandem walk, which is basically heel to toe walking, okay? Keeping it in one line. You find this challenging, please do it more lightly and try to walk heel and toe. So if you can see my feet from here, hopefully you can still see it. Okay, you can see that I'm walking my heels and toes together. Now, if this is challenging, what you can do is you can do semi. And I think some of the physios have gotten some of you to do that, which means half. Okay, hopefully they will screen, yes, half. Not fully toe and heel. Can you see that? Okay, all right, nice and easy. Okay, all right, try to look forward. Don't keep looking on the floor. There's no money on the floor. Okay, look straight. Have a wall, have someone to supervise you while doing that. Okay, all right, so that's really nice. 4 different parts of exercise: aerobic, strengthening, flexibility or stretching, and last but not least, balance and coordination. This should be encompassed in your exercise routine. It shouldn't be one versus the other, or only having one aspect of it. Okay, having a holistic exercise program will actually buff up your bones and help you in your bone health. So I hope that helps you. Okay, and I'm going to introduce you to the next speaker who will talk about yoga. Okay, now Miss Abba will be taking the floor, and what she's a senior yoga therapist. She's a very seasoned yoga trainer and yoga therapist for more than 15 years of training and treating many, many people by providing individualized yoga therapy programs for various kinds of conditions, and has received high recognition for her skills in yoga therapy, not only in Singapore, but also.
Well, thank you so much, Dr. Cindy, for the lovely introduction. And it's a complete honor to be invited here to speak on the topic of osteoporosis and how we can have a safe yoga practice with for the people with osteoporosis. And I really would want to thank you, Dr. Manju Chandran and her team in the Osteoporosis and Bone Metabolism Unit in Singapore General Hospital. And completely an honor to be sharing my knowledge and my expertise in the field of yoga for the benefits of the people who are suffering from osteoporosis. Now, as Dr. Manju Chandran has already mentioned, that osteoporosis is a silent disease, and it actually becomes very late for people to actually understand that they have osteoporosis until they have a fall or until they have already fractured either their spine or any other limb, either a thigh bone or also a wrist joint. Can we have the slides, please? So in my 20 minutes that I have for my presentation, I would like to run through my slides, which I have specially created for the purpose of educating and also for guiding all the people how to have a safe yoga practice, and by which you can have a functional life, as well as you can improve your strength, improve your flexibility, and as you can see, the topic is de-stressing your mind without stressing your bones. So as you saw, just Dr. Cindy was talking about how we can have 4 segments of exercising. One is the strength, one is a flexibility, one is a balance and coordination. So all these things can be done by yoga. So let me just go through an overview of what I'm going to present you in my slides, how yoga can impact the lives of people with osteoporosis, what is considered a safe yoga practice, what are the yoga poses that you want to include in your daily life, in your yoga practice, and what are some of the yoga poses which are contraindicated for the people who are having osteoporosis. Then also we will go through certain modifications which should be included in your yoga poses, and which is to ensure the safety of all the participants or all the people who are practicing. Why they should be modified and how they should be modified, I will run through you with certain videos which I have already shot with my student, and also you will be able to see. Just to let you know that this is not an individualized yoga program for anybody, it's a general program, and it is basically to ensure a safe yoga practice for everybody, suggestions for a safe yoga practice. So now data on whether yoga can help build bone mass is still very unclear. But a lot has been known about the other benefits of yoga in osteoporosis. So we can see that the other benefits of yoga for osteoporosis include a better posture, improved balance, enhanced coordination, greater range of motion, higher strength, reduced level of anxiety, and better gait. And if you have a better gait and you have a better posture, definitely there is a less risk of falling, as Dr. Manju mentioned before, that because when we fall, then we have chance of getting fractures. So if by yoga you can have a better posture and you can have more strength and you can actually have more confidence, less anxiety, then definitely there will be less risk of falling and less risk of osteoporotic fractures. Okay. Now, how to ensure a safe yoga practice? So, there are certain pointers that I would like you to go through with me. If you are new to yoga or you have a history of spinal fractures, it is advisable to consult your physician for clearance to practice yoga. It is of utmost importance because some of the times when you do not know you have osteoporosis, and when you know that you have osteoporosis, then you should always take clearance from your doctor before you begin a yoga practice, especially if you are new to yoga. If you have already been practicing yoga, then also it is important to see what is the level of your bone mass density and how fragile your bones have become for you to ensure that you stay safe doing any exercise. As you know that we have already documented certain fractures while doing yoga, and those I would say that because might have been because the people who were doing yoga, they were not aware of how fragile their bones are, and also the yoga instructor must not have been informed about the condition that the participant is suffering from. So it is very important that you are clear about your condition. And the second point is that your yoga instructor should have proper training and experience of working with this population. You have to make sure to inform your yoga instructor that you have osteoporosis, so that the yoga instructor or the yoga therapist is able to offer you modifications for certain poses which are contraindicated for the people who are having osteoporosis. Let me go through my another slide. While you are practicing yoga, even if you are already practicing yoga, you must always listen to your body, and you should always stop if a pose ever feels painful. You see, the body, whenever you feel pain, it is a signal that your body is sending for you to be aware that you should not be pushing beyond your limits. So if you continue to push beyond your limits, definitely you are increasing your chances of injury, which ultimately will lead you to a discomfort to your body, as well as it's not a nice situation for even for a yoga instructor to have injuries in their classes. Always take it slow and be mindful as you move into the posture and out of the posture, because the transition has to be very, very smooth, and that is why I will later tell you what kind of yoga you should be choosing for your yoga practice if you are having low bone mass density or you have already been told that you have osteoporosis. You have to always stay with your breath, keep a steady pace with your inhalations as well as your exhalations throughout the duration of your yoga routine. Why? Because when your mind and your body and your breath, they are in one straight line, they are in synchronization, they are very good to enhance a level of calmness into your body rather than inducing anxiety while doing exercises. Yoga is a relaxation response rather than an exercise. It has been documented very well in our yoga scriptures that when you practice yoga and you are aware of your body, it makes you more aware of your body. It makes you more aware of your breathing. And also it actually inculcates a sense of calm in your body, which is very, very important to have a good mind-body balance in your life. And also what kind of yoga you should choose. So I would say choose Hatha yoga, Yin yoga, or restorative styles of yoga over Ashtanga, Vinyasa and hot yoga. I will tell you why. Because when you are doing Ashtanga yoga, that time the transitions involve little bit of jumping forward and backward to move in and out of the postures, which might be a bit stressful for your joints. And in Vinyasa yoga, you have to move from one posture to another posture in a flow. And for the people who are younger, it might be very good and they might feel good doing it. But people who have certain restrictions, they have to be mindful of how they are moving from one posture to another posture. So I would say do not choose Ashtanga and Vinyasa yoga, and also the hot yoga. What happens when you do hot yoga, the tissue temperature increases and you have extra flexibility in your body. When your body and muscles are extra flexible, you tend to turn more, you tend to bend more, you tend to extend more. And that extra extension and flexion might not be good for your body when you are having a porous joints and porous bones. Let me go. Okay. Now this is a very, very important slide that I have created. This is the take home message I would say for everybody, that yoga is not about competition between you and the person next to you. It's never a competitive sport. The competition is always with you. How safe you feel, how much comfortable you feel in a posture, and how you slowly allow your body to adapt to a certain pose. That's what yoga is. It is allowing the body to slowly adapt to the poses and work at your own pace and never push yourself into extreme postures. Okay, now we have to see that what kind of movements we want to avoid into our yoga practice. So any movement which includes forward folding, complete full forward folding where the spine rounds over. So as you would know that as you grow older, you also have developed kyphosis in your upper spine, and it's already rounded. And when you bend forward, when you are in flexion, there's an extra load on your spine. And if you have kyphosis in your spine, that load actually increases. And then when you bend forward completely, that puts then the risk of getting injuries also increases multifold. So those kind of movement we would like to avoid. Also, there are certain movements which like to bend and extend the spine in forward and backward motion. Just like in 51 and 108 sun salutations, you bend backward, then you bend forward continuously. Repetitive bending backward and forward movements we would like to avoid, because anything repetitive also puts a lot of pressure on your spine. Third thing is any movement which forces the hip into full rotation with your body weight on it. We will show you in the next few slides what kind of poses are those that I am talking about. And there are quite a lot of documentation about having certain fractures in this kind of poses. Also, any jumping forward and backward movements we would want to avoid in any yoga poses. Also, a weighted Russian twist in which you are in a V shape sitting and you are twisting your spine side to side with some weights in your hands. That also is complete a no-no if you have osteoporosis. Now there are certain examples of yoga poses, the named of some yoga poses that I would like the people with osteoporosis to avoid. In the first one is a spinal rocking, in which that like you rock forward and backward, that we want to avoid. Then there is a Uttanasana or ragdoll pose. I have a video about this. I will show you in a second how ragdoll pose is forward bend and also shifting the spine side to side like sawing motion, which is not completely a no-no for people with osteoporosis. Then there is a plow pose or halasana, as you can see on the bottom right side of the screen, in which you are bringing your legs overhead and touching behind your head. It's also putting a lot of pressure on your spine. Then there is a pigeon pose or kapotasana, which is also contraindicated for the people with osteoporosis. Sun salutations with jumping. Inversions also in which you are sending on your arms, because you are fully loading, putting all your body weight on your arms. It is not advisable for the people with osteoporosis, and all arm balancing poses like crow pose and other certain poses. Now I have a video over here in which my student will be demonstrating how a ragdoll pose is done. And normally for younger population, it's a good pose to achieve maximum flexibility in the hamstrings and also to bend forward. But as we age, we need to understand that there are certain poses which we have to be a bit more careful about doing, because it's okay to do. It's all about understanding your own body, and also it is about how to adapt to our aging process very, very gracefully and naturally. If there is a gap between where you are and where you want to reach, then it creates a lot of stress in your body. So if you know that everybody has to grow old and everybody has to have like a low bone mass density, we can't avoid it. Certain things which we cannot avoid, then it's better to adapt to the poses which can be done. So any discipline of exercise is not good or not bad. Only thing is, if you know how to modify, only if you know according to your condition, if you inform your yoga teacher, if you inform your yoga therapist, if you choose your yoga therapist wisely, he or she will make a customized program for you, and it will be easy for you to develop your more strength and flexibility. Now here are certain examples of certain yoga poses which are advisable for the people to be performed under supervision and proper guidance. So the first one is the mountain pose or Tadasana, in which you stand on your both feet. So when you stand, there is a less pressure on your spine, and the gravity puts pressure on your bones, and when you put little pressure on your bones grow, as Dr. Manju was telling. There are osteoblasts which are helping the bones to grow. And then you will also know that when you sit, that time the spine has maximum pressure. So I would advise the people with osteoporosis to do more standing postures, so that you can load your joints, you can load your bones, so that your bones will continue to grow. As Dr. Manju was also mentioning, the bone is not a dead tissue, it is an alive tissue. It continuously modifies itself, it continuously grows itself. So if you do certain activities which help it to grow, it will grow. If you will not allow it to grow, if you will completely sit down, make yourself immobile, definitely your muscles and your bones, everything will start decaying faster. Then there is a Veerbhadrasana or warrior pose. So warrior pose is a very good pose because it helps you to put your feet nicely planted into the floor, open up your body, extend your spine. So it's very important for you to extend your spine, at the same time keep the spine lengthened. So yoga poses allow you to lengthen your spine, so it increases the spaces between your spinal columns. Once you lengthen your spine and then you extend, it is more beneficial. If your spine is compressed and you try to extend it, it might be harmful than beneficial for you. So all these asanas, if you do under guidance, they are definitely will help you to lead a very, very functional life. And later on you will meet our special guest who is a living example of yoga and practicing yoga, and also living a very, very functional and very lively life. So there are Shalabhasana, there is Utkatasana or chair pose, there is Setubandhasana or bridge pose, Salamba Bhujangasana or sphinx pose, then there is Shavasana, and also some pranayama or yogic breathing practices which keep the body in line, and body, mind and your breath in line. Now we will show you certain examples of certain poses. So here is an example of my student performing the sphinx pose. It is a very minor back bend, and she is actually propping herself up on her elbows and lifting herself up, looking forward. So it's a chest opening and slight minor compression on her, minor extension on her lumbar spine. Then the second one is called the Veerbhadrasana 2, and she will later progress into the Parshva Konasana, in which she is bending and pressing her forearm onto her thigh and raising her other arm. You can see the side body is lengthening and opening up, whereas one side is collapsing. So in this, she is not collapsing her bottom side down, she is actually holding it well. So this side body opening poses are also an excellent poses, so that you can keep your whole body completely straight, and also your joints can stay supple. Now this on the left side is the Utkatasana or the chair pose. Oh no, I think that we will show you the bridge pose first, or Setubandhasana. This is a lying down pose, bending the knees, lifting the buttocks up and down. Every time it is advised that you hold the pose for 30 seconds with a break of 30 seconds. So in one pose and the next pose there should be a gap of 30 seconds. And you should be able to hold the pose for at least 30 seconds to gain maximum benefit out of the pose. The next pose is called Utkatasana or chair pose. It's a modification of the squats as in traditionally done in the gym. So this also is a very good pose to improve the muscles in your thighs, in your buttocks, and also in the front and back of your thighs. And also it helps to strengthen your core muscles, because without involving your core muscles, it's very difficult to do all these poses. We move on to the next slide. So yoga poses to practice with proper guidance. You have to make sure that your legs are strong by practicing standing poses and holding each pose for 30 seconds. Whenever balance is an issue, have a chair nearby or stand next to the wall for support, as was mentioned by Dr. Cindy also initially. Because I'm always asked this question, should we do chair yoga? I would say if you can stand, do not sit. And do you want to use props for your practice? You do use props for your practice, but not to deepen your practice, but to make the practice comfortable for you. It should not be that you should not be pushing, don't make it too intense. Intense poses are the one which actually are a sign of, can create problems for your body. Now the question is asked, why should I modify the movement in my yoga practice? Well, they put a lot of pressure on your spine and hip bones in a way that increases your risk of breaking a bone. Since osteoporosis already makes your bones more susceptible to being broken, it is important that you control the pressure being put on your spine. Now let's see how we can modify the certain poses. So in Ashtanga yoga, as you will see, that there is a tradition of jumping forward and backward rather than walking forward and backward. So this we don't want to do, because this jumping forward and backward will put a lot of pressure on your spine. So instead you can start walking forward, taking baby steps to walk forward, or have a chair nearby to hold it and then slowly come up. So this is the kind of modification that I would like to be adopted in the sun salutation. Now there is a child pose which also needs some modification, because in child pose there is a lot of rounding of the back, and then we can actually remove it by using a yoga block to rest the forehead, and instead keep the front spine extended to its length and flex at the hip joint. So instead of rounding the back, I would like to hinge from the hip joint, as we will see in the next video. My student is also demonstrating here. Okay, let's see if this video is working. Yeah, so you see there's a lot of rounding in the spine in her back, as you can see in the video. So instead I have given her a pillow to keep under her chest, so that she can keep the length in the spine and also the gaze to be looking forward, so that there is no rounding in the back. Instead of the pillow, you can also use your own two fists to be placed on top of each other, so that the back is not rounded. So this is the modification we would like to be offered to the child pose. As you can see in the picture on the right side, the back is completely flat. So we move on to the next slide. So also then how you get up and how you lie down, it also makes a lot of difference, because if you just roll your spine and get up, then it puts a lot of pressure on your spine. So you have to sit down and then lie down sideways. You have to bend your top knee, put your foot down with the knee up, and then use your foot to help roll yourself over, or just roll over to your back once you are on the side. And to get up also, similarly, you roll over to side, using top foot to push if you would like, and use your hands to push yourself up. We will see in the video to see exactly what I mean. So it's like this, you are roll back and forward. This is not a good way to get up, because while you are young, definitely it would be a lot of fun, but when you are having osteoporosis, this definitely. So you move to the side, take support of your palms, slowly lie down on your side, then you can roll over to your back. And similarly, while coming back also, you can roll to one side and slowly taking support of your palm and come to the seated position. So this is how we modify our lying down and our sitting down to make our yoga practice a safe yoga practice. We move on to the other pose. There are other side bending poses which are good. So twists are especially good. So twist, if we do not include twist, it will not be good, because we need to include twist into our practice, because they do help to improve the blood circulation to the side body. So not all twist poses, but the ones that allow you to keep the length in your spine. So twist as per your comfort. Do them lying down instead of sitting down. Use blankets or bolsters to support the knees in lying down twist. And do not double wrap your legs in the supine twist. So we will just see the video how she is twisting. She is opening her arm to the side, bringing the knees to the chest and rocking side to side, which is normally done in yoga poses. But I would say that people with osteoporosis should not be doing twists in this way. Rather, they should use a blanket or a pillow sideways, keep it in line with the chest, and then slowly drop the knees down and let the knees rest on that pillow so that you're not pushing yourself too deep into the twist. You are breaking that twist by taking support of some bolster or some pillow. So that way you can allow your body to slowly twist without harming yourself. We move on to the next slide. I can show you the front view. There's another way of twisting. She's already into the twisted position, and now she will open her arm, and then I've kept a pillow sideways so that she can rest the palm onto the pillow. So that also allows her to do not twist too much deeper into chest opening rather than taking support of a pillow. So you can see the next video is giving you a different view, that she is opening her chest and placing her palm on a cushion next to her. So these are the safer ways of doing the twist in yoga, and this will not be harming to you. Next we will go, this is the pigeon pose, which is the most you can say controversial pose in for the people with osteoporosis. In this you can see that she has bent her front leg, so the hip is in external rotation, full external rotation, and she is leaning forward, so it's putting extra load onto her externally rotated hip joint. So this pose has caused a lot of people to fracture their femur bone, which is the strongest bone in the body. So how do we want to modify? So there are multiple benefits of doing this pose. So how do we get the benefits of this pose without breaking our bones? So we will see how we can modify this. So instead of doing this, we will do the thread the needle pose. Let me see if we can play the video. Yes. So this pose I would say you do not do, and rather than you change yourself to lying down position. So she will demonstrate how to safely lie down on the side and then slowly roll back on the spine. Then cross your right leg onto the left, hold the left thigh with both the hands and try to bring the knees closer to the chest. This will give you exactly the same stretch that you get through the pigeon pose, but in a milder and gentler way, without without putting pressure onto on your hip joint and without putting pressure on your femur joint. So that's all I would like to say, that this is how we can modify this pose. So I think I have come to the end of my slides. So that's all I think I can say. Where is the next slide? Can I have the next slide also? So thank you so much for joining me here. And any questions you can definitely send through the question and answer. And thank you for joining me today. And I would like to hand over the stage to Dr. Manju Chandran again for the next segment for the interview of our. Thank you.
Thank you so much, Abha. Really, I'm sure people really and thoroughly enjoyed this session, as I'm sure Dr. Cindy Young's exercise session too. So now, it is my utmost pleasure to welcome the star, one of the stars of today's show, and that is my very dear, I would like to, I mean, she is a patient of mine, but I think she has gone far more beyond that, Mrs. Lohambal Rajakrishnan. Please, Mrs. Lohambal. So Mrs. Lohambal and I got acquainted in way back, I believe it was in 2009, Mrs. Lohambal. So 2008. I have had the privilege, I think I should say it's a privilege, of having been able to take care of her since then. Now, Mrs. Lohambal, you'll get to know a lot more about her during this 15-minute interview, but suffice to say that she is an incredible woman. She is 83 years young, and you can see how gorgeous she looks. To interview Mrs. Lohambal and to get an idea of how she has actually, her remarkable life, how she has led a remarkable life, and despite being diagnosed with osteoporosis, she has not let it beat her. And to interview Mrs. Lohambal, again, I have this amazing young doctor, Dr. Sarah Tan. I could not have chosen a better person than Sarah to actually interview you, Mrs. Lohambal. I think you yourself got acquainted with her, and Sarah is one of our rising stars in endocrinology, and I hope, I mean, in bone metabolism. And Sarah has some questions for Mrs. Lohambal, and so I leave it to both of them to actually carry on. Thank you so much, both of you.
Thank you. Thanks,
for
Dr.
having
Manju.
me.
Let's have a seat.
Thank you, Sarah.
Okay. Good afternoon, everyone. I'm Dr. Sarah Tan, and today I have with me the very lovely Mrs. Lohan Bal, who has kindly agreed to share with us a bit more about her journey in osteoporosis. Hello, Mrs. Lohan Bal. How are
Hi
you?
there, Sarah. Firstly, I want to thank Dr. Monju and you, Sarah, for having me here this evening. I'm going to, I think, enjoy myself.
Definitely. We're lucky to have you. So
Thank
before we get in with the questions, perhaps could you just share with us a little bit about your life? I can see you're wearing such a beautiful sari today.
Yes, thank you. Thank you for your compliment. Well, to begin with, I am a Singaporean, born and bred in this country, and I am also a retired school teacher.
Oh, wow.
Yes, I began that journey way back in 1960 and ended it in 2005-06, around there. Yes,
Very long
I
career.
thoroughly enjoyed my profession. I loved it, every moment of it, and led a very active life during that period.
Wow, that's
Yeah.
really interesting. Okay, so I think we'll get started with the questions. To start with, could you tell us about how you first found out that you had osteoporosis?
Yes, it was a very unfortunate incident
Oh
that
dear.
took place. I was on my way home. I just crossed a very busy street, very heavy traffic, crossed the street, and just as I got to the other side, to the grass verge, suddenly my right foot kind of like turned to the side.
Dear.
I lost my balance, fell forward. It was like as if I had stepped on a pebble or stone or something. But I don't think that was the case. Anyhow, when I tried to get up and stand on my feet, I could not put any weight on my leg.
Oh dear.
Somehow I managed to find my way home. But because the word fracture never at any point entered my head, I actually assumed it was just a sprain,
I see.
you know. And I said, well, typical of me, I'll just sweep it under the carpet. I said, this is going to go away. You know, so I sat the whole night with my leg suspended in mid-air.
Oh, no.
Yes, and gradually it started to throb and there was pain. So I could see that this pain was not going to go away. Early the next morning, I got myself into the hospital. The doctor checked me out, sent me for x-rays, came back and confirmed the news that I had sustained a fracture.
Oh dear.
Yes, it was my fibula, just
okay.
above my ankle. It had just snapped,
Oh
like
dear.
a twig. It just snapped. It was clean, so no surgery was required. I was casted, fitted with a pair of crutches and sent on my way home.
Oh, okay. And
Yeah.
were you told at that point that you probably had osteoporosis, given that you had a fracture after such a small fall?
No, no mention was made of osteoporosis. When I went back for my review, 8 weeks later, I believe, the cast was removed and the doctor gave me some calcium tablets,
Okay.
as I recollect, and sent me home.
Ah, okay.
So that was the end of that.
I
yeah.
see. And when was the diagnosis of osteoporosis officially made?
But 3 years later, I
Ah,
was
okay.
referred to Dr. Monju,
Oh,
Dr. Monju Chandran, for other issues,
I see.
other blood issues, I think. So when I was consulting with her, and she dug deep into my history, I mean, you know, it was serious stuff. She went into family history and all of that, and I revealed to her about this incident that had taken place 3 years ago,
I
about
see.
my
The
fracture. And Dr. Monju took all that very seriously, and she sent me for tests immediately, blood tests, bone density tests, height, weight, all of that. And on the next consultation with her, she revealed to me that I had osteoporosis.
Ah, okay. And what had you known about osteoporosis before that?
Absolutely nothing.
Ah, okay.
I mean, to be honest, I don't think I had even heard of that word. I mean, I know the importance of taking calcium and all of that, and how calcium helps our bones, our nails, our teeth, particularly during our growing up period from a child. Parents used to mention all that. But the word osteoporosis and what implications it bore, I had no knowledge of.
Oh
Absolutely
dear.
no knowledge.
It must have come as a shock then. How did you feel when you first
Totally.
found out?
I was floored.
Oh.
I was totally devastated, and my mind just ran wild. But Dr. Monju, she really, took me under her wings, so to speak, and assured me that it's not the end of everything. The fall was an indicator 3 years ago. Had I made it a point to seek for some kind of investigation or treatment, further treatment, I would have discovered it. Unfortunately, I didn't. So Dr. Monju sent me for all the tests that was required, and she put me on medication.
Ah, okay.
Yeah, and told me how important it was to take all of that, and that I would be able to improve strength of my bones, and quality of life will in no way be affected, and I can live a near perfect life. I don't have to make any drastic changes. And very importantly, Dr. Monju did this. She continuously reviewed my test results and made whatever necessary changes there were to be made where my medication was concerned.
Ah, okay. And could you
So-
tell us a bit more about the medication and how you took it? Any tips for some other patients who may also be on osteoporosis
Yes.
medication?
One very important tablet she gave me, I don't know whether it should be called a pill or a tablet, but I used to call it my once a week tablet.
Ah, yes. Many patients do call it that.
Yeah, my once a week tablet. So I chose to take it on a Monday. So every Monday, religiously, I had to take that tablet. It was a very powerful medicine for my bone deficiency. When I took the tablet, it had to be taken in an empty stomach.
Yes,
And I had to
exactly.
drink lots of water and stay vertical. In other words, I can't take it 10 minutes later, jump back into bed and continue with my nap. I was not supposed to do that. So what I did, and I was a very physical person, religiously going for my walk and all that, I used to take that tablet and then go for my walk. So
okay.
for 1 hour, that did its work inside, and at the same time, I complied with all the regulations. Besides that, she gave me a lot of supplements, some medication. I had a little bit of joint issues, some medication for that, which I'm still on, and monitored me very, very closely. Recently, I must add, she has taken that 1 week tablet off, so I'm quite happy about that. But she is seeing me more often
to monitor.
keep a close eye on the results of my tests. So I see her now, not yearly, but every 6 months.
Okay.
So
I
she
see.
just wants to see how I progress, and I guess she will take it from there.
Yeah. It's really amazing to hear how invested you are in your own health and how you can remember exactly how to take the medication
Yeah.
after all these years. How about any lifestyle measures that you took in terms of adapting your lifestyle after you found out you had osteoporosis?
I had to make several changes. I'm still learning, going through that learning process. I had this habit of rushing. Everything must be done fast. Speed walking, no walking slowly, speed walking. You know, if I get up to go to a certain section of the house, I will be like literally sprinting there. So I have to keep reminding myself, slow down. Slow down, because falls occur when we are in motion, right? So if we are going to be callous, and you know, once you are osteoporotic and you are aging, that aging process is going, I'm no more a spring chicken, right? And sometimes we lose our balance. And that is the trigger factor for a fall, which can end very, very badly. Dr. Monju has so often told me, a fracture begets another fracture.
Yes,
So I
indeed.
try so hard to remember that. What am I rushing for? I rush for the bus, I rush for the train. Slow down, slow down. My kids, they often, you know, yell after me, don't rush. Please slow down. And I've also learned to be a little bit more alert and focused, particularly when I'm in public places. There's the stairs to deal with, there's the escalator to deal with. I try to remember, use the railing, hang on to something.
Yeah.
You know, if you're on a travelator, don't walk on the travelator, don't run on the travelator.
Definitely.
But it happens, it does happen. I mean, for that moment, you forget. You know, why? I'm standing so still, this is moving so slowly. And I am also a little bit more aware of my footwear. I think that is very important agent. I mean, if there's a fancy footwear and a comfortable and well-fitted footwear, at this point of my life, I have to go for the comfortable footwear. Low heel,
still
no
look
more
great.
the fancy heel. Those were the days, and you got to kind of like move on. Yes.
But I think it's really great that, you know, you employ caution
Yeah.
and you're more careful with yourself because you know how dangerous a
Yes.
fall can be.
Yes,
How about
indeed.
in terms of staying active? I mean, you told me that you're still very active and still doing a lot of exercises.
Oh yes, oh yes.
How do you balance
that?
that?
Has not stopped. Only everything is kind of like simplified and in moderation. One thing I've also learned is to listen to my body. You cannot exercise to the point of exhaustion. Your body will resist it. Then you have to listen. Oh, it's time to stop. Don't push it. It doesn't mean you want to do 20, say, sit-ups. But when you reach that 15 mark, you are straining to complete that 20, then stop. I mean, there's no, what are you trying to prove, right? Learn to listen to my body. And the other thing I try to be aware of is clutter. You know, clutter. Clutter in your home, clutter in your room, empty boxes, empty cartons. I think it's a huge trigger factor for a fall. And also learn to use night lights.
Okay. So making these environmental modifications.
Changes and modifications.
Yeah,
yes.
so I think it's a very good balance that you're able to stay active, but yet you're taking all these precautionary measures
Yes.
to avoid a fall.
Yeah.
Yeah. Any last words, Mrs. Lohambal, that you would like to share?
Well-
Any takeaway points for our listeners who may also be journeying with osteoporosis?
Yeah. You know, it's very upsetting and disturbing to hear that you have a certain silent disease, in this case, osteoporosis. Nevertheless, I would like to tell my brothers and sisters out there that it's not the end of the world. You know, you do not have to make drastic changes in your lifestyle. You're not going to be condemned to a sedentary life. On the contrary, as we have learned this evening, with osteoporosis, you are required to do exercises. Keep your body parts moving, keep that circulation moving, and the only thing is exercising with osteoporosis simply means go for the safest, most enjoyable, and what exercises are suited for your general health and your bone well-being. Like if you enjoy dancing, go right ahead and dance. At one time, maybe we could do the tango or the twist. But now, we no longer can do all those intricate movements. We go for the slow waltz. And
That's
we
a nice
still have
piece of advice.
enjoy a beautiful evening. One other important news I'd like to tell everybody is please do not listen to fake news.
Yes.
Promises of miracle cures. Leave your health and your body in the hands of your physicians. Do what they tell you. And we can age gracefully and be part of a very gracious society. On that note, yes.
Thank you so much, Mrs. Lohambal. It's been like such a wonderful few minutes with you, and I think even within this short interview, you have left a very positive impact on our audience.
Thank you
It's
so
been really
much,
lovely having you.
Sarah, thank you so much to having given me this privilege to share my journey with osteoporosis. Thank you,
All
Dr.
right.
Manju.
We'll hand the time back to Dr. Manju. Thank you
you.
everyone for listening.
Just stay there for a few minutes. I just would like to, thank you so much, Mrs. Lohambal. Now, I think, people all over the world probably realize why I said truly that it's a privilege to have this wonderful lady as my patient, and she's become a friend over the years. So thank you again, and with such a positive message that you gave at the end, that despite, don't let osteoporosis beat you. There are medications available. You have a discussion with your patient. You would still continue an active lifestyle, but as Ms. Abha and Dr. Cindy Ng said, exercises, yoga, whatever you're doing, you modify it a little bit to kind of suit your particular situation, but that should not stop you from doing it. So again, my heartfelt thanks. It's not just from me, but from the rest of my team too. And thank you so much, Sarah. You're a wonderful interviewer. I think you've got a great future. So maybe BBC is listening, and they might take you on. Thank you so much. Thank you so much.
Thank you very,
please,
very
please,
much.
So now, it is, I'm saying that, it's my pleasure each time, and really this is again another significant pleasure of mine to welcome the next, I shouldn't say speaker, but the next expert on stage. Now, Zumba, as all of you may know, is a high-intensity workout designed to move every part of your body, get your heart rate up, and build endurance. Ms. Sneha Yadav, our instructor today, is the founder of Dancing Feet Masti Se Sikho, a dance academy in Singapore, which specializes in teaching various dance forms ranging from semi-classical to modern hip-hop. She's also been teaching Zumba for the last couple of years to both children and adults. Sneha Yadav is a Women Lines Entrepreneur of the Month, and in her own words, dance isn't a form, it's a way of my life. On a personal note, again, Sneha is a very dear friend of mine and holds the unenviable honor of teaching me also to dance, a Herculean task which she accomplished with aplomb. The 3 songs that she's showing us the dance steps to today are fun, peppy, cannot resist tapping your feet, two kind of numbers, handpicked by me and her. They are Sweet but Psycho by Ava Max, and two Bollywood numbers again which are my own favorites. Of course, the first one is Desi Girl from Dostana, and the last song is Mukabala. So enjoy, get up off your feet, and as Dr. Ann said in the beginning, but please make sure that it is in safe surroundings that you do it. Sneha, over to you.
Apologize for the interruption. Thank you so Manju for the kind introduction. So we're going to start with some warm-up exercises. So let's start. Breathe in and out. Breathe in and out. Breathe in and out. Move the neck. And other side. Later, move your waist, hands, so after the warm-up, we're going to do some fast moves on fast music, and we'll end the session with the slow music. And the legs keep kicking. So let's start and follow me and let's sweat it out. So music on, please. Louder. Everyone, please clap. Join. Snap out, and close. And hands up. Together. Repeat it.
Oh, she's hot but a psycho. So left but she's right though. At night she's screaming, I'm out my mind.
Hands out. Close, open, close. Open, close. Very good. Put some more energy. Everyone. Together. And throw the hands back. Carry on. Wave the body. And continue the same. Snap out. Repeat it. Hands back. Open, close, open. Together, legs front, back, clap. Front, back, clap. And repeat it. One more time. Together. Hands back. No. And together again. Back the hands. Wave the body. Snap. One more time.
nights you're screaming.
Repeat. Legs, front, back, clap. Front, back, clap, clap, clap. And keep moving your waist. More energetic. Keep moving your waist. Move forward and back. Leg, front, back, back. And again, other side. Hands. Keep moving your hands. Other side. Repeat it. Together, go. And 1, 2, 3, 4, 5, 6, 7, 8. Come on, front. And clap. 2. Clap. Double. Faster. Slow and slow. Shake the body. Shake the shoulders and keep moving your legs and toes and repeat it together with the full energy. Sweat it out. And move your heels and toe. Slowly and fast. Change and hands fly again. Other side. Keep moving your arms. Shoulder. Other side. And right, left, and come on, everyone. Together. Come on, move the heel and toe. All right, slow. Let's do the slow moves. Breathe in, breathe out, relax. Small jumps. Keep moving your body, hands. Move the legs. And roll, out, and statue. One more time. Let's move the heels and toe. Heels and a toe. Those who can do fast, Too fast. 1, 2, pull and 1, 2, pull and move the arms. Other side. Roll and a hit shoulder. Move the leg in. And come on. Come on, everybody, together. Repeat it. And forward, back, forward, back. Heel, toe, heel, toe. Move. Move your bones, everybody. Spread it out. Faster. Let's go more slower. To end the session. And clap out. Faster. Jump. Jump. Jump, 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 jump. Breathe in and out. Thank you so much. So now to question answer session.
Incredible, Sneha. Like I said, I'm one of those people who, even though I don't know how to dance really well, if I hear such foot tapping music, I can't resist myself getting up and taking a few steps. So thank you so much, Sneha. And the songs, for just those of you who want to know, you can go back and check. One was Sweet But Psycho. The other is Desi Girl, which means that local girl, and saying that local girls are the prettiest. And the last one was Mukabala. With that, now it's my turn. I'm panting because I really kind of did a good workout there. It's a Q&A session, and I leave it to my trusted right and left hand persons, which are Xiaoming and Xiaofeng, my osteoporosis nurse clinicians, to moderate the session.
I believe all our audience must have been up on their feet and dancing away.
Yes, we are almost at the end of the session, which is the Q&A. We have invited Dr. Manju, Dr. Cindy, and Miss Abba onto the stage to help answer the questions. By the way, Dr. Manju, many people are saying your skeletal leggings are really cool.
Oh my God, okay. Yeah, well, thank you, Xiaofeng. It's kind of fun. I know, I just try to kind of, lift things up a little bit. So obviously being an osteoporosian, I felt it was kind of fun to wear this. So thank you.
Okay, well, we should start our questions.
I think there are
Let's
several
look
of
at
them.
the questions from the Q&A box now.
I think there were like almost 100 questions, right? So.
Yeah. Okay, the first question asks, should BMDs be repeated in the same center each time that is done? This one, can I invite Dr. Manju to answer?
Okay, so we're kind of diving deep into like hardcore osteoporosis monitoring and treatment. Yes, we BMD, by BMD, what we mean is bone mineral density testing, and that's done with something called a DEXA scan. And we recommend that DEXA scans be, if possible, be repeated at the same center during monitoring. And this is because there are different manufacturers of DEXA machines. So you can get changes in the bone density if you do a DEXA scan 1 year in one place and another year at another place. So it's always best. And there are so many other variations, which obviously in such a short Q&A, it's impossible to go through all of those. So we recommend that bone density tests be done at the same place every year.
Okay, thank you, Dr. Manju.
Okay, let's look at the number 2 questions. Okay, this is a 72 years old gentleman asking. He has been doing the intensive weight workout 3 times a week for the past 5 years. Then he's asking, as he getting older, should he continue on this? Maybe we invite Cindy, Dr. Cindy, to answer this.
Well done. All right, for a 72-year-old man doing resistance training 3 times a week, I think you should continue. Well done on you. Yeah, you're maintaining your muscle mass. And some of this strength training not just build up your joints, your bones, but also your muscles per se, all right? And if you don't have any pain, any numbness when you're doing them, then just keep doing it. There shouldn't be any issues. Yeah.
Thank you, Dr. Cindy.
Okay, let's continue look at the questions. Okay, Miss Abba, do you conduct yoga sessions? If so, how can they join your class?
Of course, yes, I do conduct yoga sessions. And actually, I'm a yoga therapist, so I do not conduct basic yoga classes because there are many yoga instructors available in Singapore. So I'm a yoga therapist and I have about 15 years of experience in upgrading my skills every year. So I basically take one-on-one clients who have certain conditions like osteoporosis, and I do customize a special program for them which they can follow, and I can regularly supervise them and guide them accordingly. Thank you so much.
So if I may, Abba, I think Abba had put up her one slide. Abba runs Mind, Body and Symphony. That's her yoga school, so yoga academy. So you can Google and find out,
they can
because
Google it.
yeah, so it's called Mind, Body, Symphony. We are not promoting any particular person or agency, but you obviously saw how wonderful her sessions were. And I personally, me and my team, we would not have chosen just about anybody. It was with the reason that we chose Ms. Bajaj. So you can Google Mind, Body and Symphony.
Thank you, Dr. Manju.
Well, let's look at the next question. Okay, someone is asking, what causes hypercalciuria?
Wow.
Okay, for this, we invite Dr. Manju.
Yeah, so again, this is hardcore osteoporosis. And so when I was talking about secondary contributors to osteoporosis, I brought up mention about hypercalciuria, which simply means too much calcium. Hyper is obviously too much calcium in the urine. So, and I also did say that sometimes hypercalciuria or over-excretion of calcium in the urine may be due to too much salt intake, because salt causes leaching of calcium from the bones and it prevents reabsorption of calcium from the urine. So too much salt intake. Too much caffeine. Caffeine also can cause calcium to be leached out from the bones and into the urine. So these are kind of the dietary kind of stuff, but there are also other conditions which cause hypercalciuria. There's something called idiopathic hypercalciuria, in which we really don't know what the cause is, but definitely hypercalciuria. One of the things that you can modify is cutting down the salt in your diet and cutting down the caffeine intake. In fact, when I see a patient who has hypercalciuria, and which is picked up by, for instance, for the people who do not know this, it's picked up by a urine test. We usually do a 24-hour urine calcium. And if we find that the calcium in the urine is high, myself or Dr. Ann or Dr. Sarah or my nurse clinicians, Xiaofeng and Xiaoming, the first thing that we do is we send the patient to the dietitian to kind of teach them a low-salt diet.
Okay,
Thank
thank
you,
you,
Dr.
Dr. Manju. Okay, let's continue look at the questions. Okay, what particular movements in sports, including dancing, body aerobics, kickboxing, keyboard fitness, to avoid for people with osteoporosis? Can I invite Dr. Cindy to answer this?
Okay, so one of the things is if a person has osteoporosis, we would not advise the individual to engage in activities where it's very high impact, which requires a lot of dynamic, sudden twisting or sudden thrusting movements per se. Yeah, so I can't really comment on some of the classes out there, but if you have a reliable instructor, let them know that you have osteoporosis. And what they can do is they can modify some of the activities for you, all right? It can actually bring down the intensity or even modify the range where in a dance routine, Okay, so nothing that is very fast and impactful and trusting and dynamic in that sense if you have severe osteoporosis. Yeah.
Okay, thank you, Dr. Cindy. Let's look at the next question. What is the difference between osteoporosis and osteoarthritis? So, Dr. Manju, please.
Okay. So this is a question that we get asked very, very often, and I'm sure Cindy will also agree. As a physiotherapist, she also gets asked this question. So osteoporosis, like what I have been talking about, is porous bones, and that's a bone problem essentially. So it's essentially the bones become very fragile. Osteoarthritis, on the other hand, is actually the degeneration of the soft tissue between bones. So all our bones, in between our bones, there is this little soft tissue called cartilage, and as we grow older and when we put on more weight and all that kind of stuff, and also aging, of course, this cartilage starts degenerating in between the bones, and so then the bones start rubbing against each other and causes pain, and that's what osteoarthritis is. Completely totally different kind of diseases, and the treatments for it are obviously very different. So but a good question, because people are often confused between these two terms. Seems to be several more questions, but we'll try to answer just a few.
Okay, we have more questions. Is it okay to do Iyengar yoga for people with osteoporosis? Ms. Abba?
Yes, I think if you're doing yoga, if you are already doing yoga, then it is okay to continue with the Iyengar yoga practices, because they do focus on body alignment. But if you are new to yoga and you have been diagnosed with osteoporosis, I would suggest that you look for a yoga therapist rather than just a yoga instructor. And the person needs to be little knowledgeable and experienced in this field and has experience of handling students with osteoporosis, who can design a program which is specially designed for your particular needs. I think that would answer your question. Thank you.
If I may ask, just what is Iyengar yoga? What exactly is that?
Okay, so there are actually different masters, yoga masters in India, who have designed their own style of yoga.
Okay.
And BKS Iyengar is a very, very revered yoga master.
Okay.
And he used props like yoga chairs and ropes and also certain bolsters which can help people to deepen their practice. But over here in osteoporosis, we do not want you to go deeper into the poses. We do not want you to become a yoga teacher or yoga practitioner. We want you to use yoga so that you can live a functional life. We want you to use yoga so that you can improve the quality of your life.
Okay.
So that is the difference, that if you are already practicing yoga, there is no, I would say there is no contraindication that you should not continue with the same Iyengar yoga teacher. But if you are very new to yoga, then Hatha yoga would be very gentle for you to start with.
Okay.
I think that answers your question.
It does.
Thank
It
you.
does. I'm sure it answers the question.
Yeah.
And,
Thank you, Ms. Abba, for your explanation. Okay, next question. Some people who are very busy at work may find it hard to exercise for 20 minutes a day. So what are the most efficient exercises to go so that they can get the most effective workout? So Dr. Cindy, please.
Okay, so I think we are all very busy individuals. I think one of the latest guidelines from ACSM is that every minute counts. So even if you can't get 150 minutes in a week, every minute counts. If you can spare 5 minutes to do even marching on the spot, or watch a video and follow the routine, even for 5 minutes every single day, it adds up. The problem with a lot of us, we don't do it, or we probably reserve it when we are free, which is quite unlikely actually. So I think being regular with exercise is what you will see, you will actually see the health benefits. I think that's very important. It's that being regular with the activity, being intentional to set aside some time, even 5 minutes, all right? And then getting engaged in the exercise to see the health benefits in your body. All right, so every minute counts. That's the recent guidelines per se, because they understand how busy we are, especially right now with the global COVID-19 situation. Yeah.
Oh, that's very
Thank you,
true,
Dr.
I think,
Cindy.
right?
Yeah.
And I think, Mrs. Lohambal, who we interviewed earlier, is a living example of how you can fit exercise into your daily life. She worked as a busy teacher for 44 years, and that did not stop her from doing exercise and carrying on with a very active physical life. Yes, completely. Good message, Dr.
Okay. Do we still have more questions? Okay. What's the best calcium supplement to take, and asking whether calcium causes kidney stone and heart problems? Dr. Manju, can you please answer
now
this
this
question?
is, how long do we have? I could spend the rest of today evening talking about this. Now, as I said in my talk, the best source of calcium is really from the diet. And we recommend calcium supplements only in those people who cannot take calcium for some reason, who cannot, have calcium-rich products in their diet, who are lactose intolerant, who cannot stand other non-dairy sources of calcium, and of course in older people who may have problems with calcium absorption. And also in our clinics, you will see patients being put on calcium supplements in those patients who are taking certain kinds of osteoporosis medications. So what type of calcium supplements is a little difficult to answer in a short Q&A, but essentially what I tell people is look at the bottle, at the reading on the bottle. Calcium carbonate is actually the type of calcium. So calcium is combined with with carbonate, can be combined with citrate, it can be combined with gluconate. There are several forms of calcium supplements available. Calcium carbonate has the advantage that it has the most amount of elemental calcium per tablet. So which means that you probably will need to take less number of calcium tablets to meet the same required amount of calcium. Calcium citrate, has much lesser amount of elemental calcium in it. Calcium carbonate is 40%. So calcium citrate, but it's probably a little easier absorbed. So maybe in older people, very old people who have problems with absorption, I might put them on calcium citrate. But other than that, calcium carbonate, because the pill burden is much lesser, calcium carbonate, because it has got most elemental calcium in the diet, most elemental amount of calcium in per tablet. Now the other question, what was it, heart disease? And now that's a big concern in recent years about whether calcium is associated, calcium supplements, okay, not from the diet, whether it's associated with heart attacks, etc. Again, it depends on your baseline calcium intake. There are some concerns about whether taking too much calcium supplements may cause, may be associated with adverse effects such as increased risk of heart attacks. But that's when you take beyond a certain limit. The same thing for kidney stones. But 1,000 milligrams a day of calcium, total diet and supplements together, should not be an issue.
Okay, thank you, Dr. Manju, for your very specific explanation. So let's continue to look at the next question. Okay, should sunscreen be worn during sunlight exposure for vitamin D benefits? And how do we balance risk of sun cancer, skin cancer, I believe, skin cancer versus sun exposure?
Oh, again,
Yeah,
I guess
Dr.
it's
Manju.
up to me to answer this. Again, I don't think we have much time left, but a quick answer is that yes, it's always, life is like that. You are weighing risk versus benefits in every situation. The same for this also. Definitely, there is an increased risk of skin cancer with sun exposure. So what we are telling people, however, is not go out and stand from morning till evening in the sun or to sunbathe for several hours. Like I told you, the best source of sunlight, the sunlight which makes vitamin D the most efficiently in your skin, is between the hours of 10 and 3 with that particular nanometer, that spectrum. So what I tell people is that all you need is about 10-15 minutes per day of exposure during that time, without sunscreen. Okay, just expose your arms and legs. Okay, if you're worried about fair, your face tanning and all that, don't. You can still continue to put sunscreen in your face, but just expose your arms and legs for 10 to 15 minutes per day. Maybe even 3 to 5 times a week is more than enough. For darker skinned people, maybe a little bit more is needed, little bit more exposure is needed, because obviously we have more of melanin, which prevents the sunlight from making vitamin D in the skin. So it's all a balance, and it's definitely, we're not recommending that you go out and expose yourself entire body to the sun for several hours. So between 3 to 5 times a week, 10 to 15 minutes each is what I would recommend. I usually tell my patients, why don't you just go out, at lunchtime, just go and have your tapao. We call it tapao in Singapore, which is basically takeaway. Just go and sit and have it outside in the garden for 10, 15 minutes. That should be more than enough.
Okay, thank you, Dr. Manju, for the very clear answer. Do we have more questions? Okay, we have one more question asked about yoga. Some yoga poses involving simultaneous flexion and the twist should be avoided because of the stress on the spine. What are your comments on this? Ms. Abba?
Yeah, I think we have addressed this spinal flexion and twisting in the poses to avoid in my presentation, in which the ragdoll pose was there, in which you are bending forward, the spine is in flexion, and you are moving your body side to side, because that puts extra pressure on your spinal columns, and that has to be avoided. And also some seated poses in which you twist to your maximum capacity should be avoided, because the more you twist, the more you are putting your bones at risk of fragility fractures, which we would like to avoid. And for that I had suggested that the twist should be done lying down rather than seated, because when you sit, there is double the pressure on your spine rather than standing and lying down. So you need to see that how much reduced pressure you can put on your spinal columns, so that you can safely exercise without putting any harm or any risk on your spinal columns for fracture or any other ligament tear or anything, because that's what I also mentioned, that do not go for intensive things in yoga. Always go for moves which allow you to grow in your strength and flexibility. Thank you.
Okay, thank you, Ms. Abba. Okay, due to the time constraint, we now will have the last question to answer. Let's look at the question. If people don't have good balance, what exercises are more suitable for them? Okay, Dr. Cindy?
Okay, so if they don't have very good balance, it's always good to see one of us to assess what you mean by not good balance. Then we can actually modify the exercise for you. And some of my patients who don't really have good balance, they actually have a wall or a chair, a sturdy chair or a furniture to actually hold lightly while they do their balance work. Okay? There are different parts of balance that we need to look at. Static balance means you don't move, and maybe you stand on one leg. Dynamic balance is where there are movements, maybe turning your head, okay, or moving like what I was showing you, walking heel to toe. So we really need to assess what do the individual mean by not good balance, and then we prescribe the exercise to improve their balance per se. One of the things about balance is we do not want the person to fall. So besides teaching them balance, we also need to teach them, if they lose the balance, how to catch themselves, right? Okay, all right. Rather than reaching out their hands and breaking a fall, what else can they do? Yeah, so these are some of the things that the physiotherapist can address with you. When you see the doctor may think that you may benefit from seeing a physiotherapist, and the physiotherapist will carry out the necessary assessment.
Okay, I think Xiaoming and Xiaofeng, may I close the session? I think we've got hundreds of questions actually, but we obviously could not answer all of them. So what my team and I have decided, with the consent of our patient liaison service, the secretariat, is that in the next couple of weeks, you can expect what we'll do is my team and I, we will painstakingly answer all those questions, and we'll email it out as a document to all the attendees of the webinar. So that's a promise from me, but please wait for a couple of weeks. And I think Dr. Cindy Ng was also asked by a couple of people whether she could send an exercise sheet, which Dr. Ng has very kindly agreed to. So in the next couple of weeks, you can expect that answers to all your questions, I think there were like hundreds, to all your questions, as well as this exercise sheet. So So with that, I think it's my privilege now to close this session, and for that, may I invite Dr. Ann Kui, Mrs. Lohambal, Dr. Sarah Tan, and Ms. Neha Yadav back on stage. We kind of have to adjust a little bit to maintain that 1 meter social distance. So this is, I would like to close off the session. So let me start by saying that it has been an incredible experience for us in the last 14 years. Like we said, we've been doing these public forums for the last 14 years, and each time I still work up I almost go crazy because I get very nervous thinking that, oh my God, how is it all going to work out? But in the last 14 years, thank God, everything runs smoothly. And really, in the last couple of years, it has been an extra hard because we had to really put our thinking caps on to make these virtual forums interesting and valid. So I really hope that all of you enjoyed this. I would like to thank my fantastic team, of whom I'm so proud of. I get a little teary-eyed. Their commitment and dedication knows no bounds. Anne, Sarah, Xiaofeng, Xiaoming, Cindy, all of you, thank you so much. And thank you, Mrs. Lohambal. I can't hug you, so we'll just do a virtual kind of elbow bump. You've been a joy to take care of all these years. I'm privileged to be a doctor. And your sharing today was absolutely delightful and inspiring. I would also like to pay special thanks to Mr. Samuel Duong from our Patient Liaison Services and Ms. Nurain, our Department of Endocrinology Secretary, both of whom you haven't seen today, but have been beavering behind the scenes to make our program run smoothly. I would like to say a big thanks to this camera crew, this film crew, Cavemen. There are 5 of them here who have done a phenomenal job, and they did it for us last year also, and they did a phenomenal job this year also. So thank you so much. I also would like to acknowledge the scientific endorsement by the International Osteoporosis Foundation, which is the world's largest musculoskeletal organization, and in fact are the organizers of the World Osteoporosis Day campaign, the chapter of endocrinologists, College of Physicians Singapore, and the OSS. These kind of forums require funding to run, and I'm very thankful to our industry partners, DKSH, Amgen, Zuelig Pharma, and Hyphens for their generous, unrestricted educational grants. I would like to thank Abha and Sneha, both of them my very dear friends. Both of them I've known for more than a decade, and they've been my rocks and pillars of support all these years. And last but not all least, I would like to thank you, our audience the world over. I was told that we have even people tuning in from Australia and India, and my parents are amongst those who are tuning in from India, but there are plenty of people tuning in from all over the world. Our Wishbone support group, which is women and men in support of healthy bones at SGH, and our patients at Singapore General Hospital. Till next year, sayonara from all of us. Take care and stay safe. Thank you very much.